Today is Tuesday, September 7th. I had been in this routine of weekly updates, and so here's one more. But I think this one will be brief, and it's possible that there may not be any more updates after this. So today we have 161 COVID patients at the UF Health Shands Hospital. My last video, which is just over a week ago, we had 212. And so the active COVID patients in the hospital has dropped pretty dramatically. That's really wonderful. I think all of the varied efforts in our community, in the surrounding areas, are working. Vaccination rates, we know, are getting better. People are masking. People are aware of creating social spaces. People are utilizing outdoor versus indoor. People are aware of the status of the people they're around. So I really think all of these strategies have come into play. What I didn't realize, quite honestly, but is still an amount of work to all of the staff inside the hospital, are the number of patients that are here with COVID-related illnesses. And I didn't fully grasp it until this weekend, quite honestly. I was walking on the medical intensive care unit, and I stopped to talk to a critical care physician. And the end of the conversation really crystallized for me that there are so many patients that you as the staff here help improve. They get better. They pass their COVID infectious status. So their infection is resolved, but they're still here. You're taking care of them. And then there are other patients that you help get better. They get home, and then they come back. In fact, by this morning's count, we have 80 such patients that are in our building. 80 that are either here and their COVID is resolved, or 80 that are here because they've gone home and come back. So on top of the 161, there still are so many more patients that are taking your time and effort, that are very sick. And so I am pleased that the COVID positive numbers are going down, but I am much more in tune with the amount of work that is still needed for all of the patients that have resolved their COVID status. Let's keep pressing vaccination. Let's keep pursuing masking where it makes sense. Let's consider outdoor versus indoor. Let's create some social distancing when we can. I think all of those strategies have benefited us to this point. They will continue to benefit us. Around us in the neighboring communities, things are either stable or a little better. Columbia County is still struggling. Putnam County is still struggling. Marion County is a little better. But all of our strategies will continue to help things improve. And of course, with any questions, please visit the bridge or please visit ufhealth.org. There's so much useful information. If anybody has questions about the vaccine, about the monoclonal antibodies, about masking, all of those are available to you. For all of you working at the UF Health Shands Hospital, thank you again for all you do. Thank you for so many patients you're taking care of.